The urinary system, also known as renal system or urinary tract. It consists of the kidneys, renal pelvis, ureters, urinary bladder, and urethra. Now let's start with the kidney. The two bean-shaped kidneys are located in the retroperitoneal space, with one on each side of the vertebral column, below the diaphragm and the lower edge of the rib cage. Retroperitoneal means behind the peritoneum, which is the membrane that lines the abdominal cavity. The function of kidney is to constantly filter the blood to remove waste products and excess water. It also helps the body maintain the proper level of fluid, produce hormones that control blood pressure and make the red blood cells, and activate vitamin D to maintain a healthy bones. There are two main structures of the kidney, which are renal cortex and renal medulla. The renal cortex is the outer region of the kidney. This layer of tissue contains more than 1 million microscopic units called nephrons. Nephrons are the tiny filtering units in the kidneys used to remove urea from the blood. And renal medulla is the inner region of the kidney, and it contains most of the urine collecting tubules.
Okay, now moving to my part. The dilated portion of the ureter in the kidney that resembles a funnel is called the renal pelvis or pelvis of the kidney. It is created when the major calicles merge, serving as a route for urine to move from the major calicles to the ureter. It has a mucous membrane, transitional epithelium covering it, and a lamina propria layer beneath it that is composed of loose to thick connective tissue. Together with the other renal sinus components, the renal pelvis is located there. In addition, similar to the bone pelvis, the renal pelvis also received its English name from the old Latin word pelvis, which means basin, as in wash basin. In both instances, the term refers to the structure's form, and in the case of the renal pelvis, it also refers to its purpose. According to the term, each renal pelvis gathers urine from the calicles and directs it into the ureter in a manner similar to how a wash basin gathers water and directs it into a drain pipe. On the other hand, numerous kidney cancer subtypes and pyelonephritis-related infections both affect the renal pelvis. The renal pelvis size is crucial in determining the severity of hydronephrosis. For reference, hydronephrosis is a frequent birth abnormality linked to obstructive nephropathy. Can result from malfunction in the peristaltic system that transports urine from the kidney to the bladder. Anteroposterior renal pelvis diameter is typically less than 4 mm in fetuses up to 32 weeks of gestation and 7 mm after that.
Next, for my part, I'll be explaining more about the ureter. The ureter are the pair of muscular tubular structure responsible for taking urine from the kidneys to the urinary bladder for storage prior to excretion. They are each about 26 cm long, collapsible S-shaped channel. The renal pelvis is where they are the widest, and the urinary bladder is where they are become narrow. The lumen of each ureter is lined by a mucosal layer of transitional epithelium that accommodate the increase in pressure when the volume of urine leaving the kidneys increase, minimizing the risk of rupturing ureters. The ureteral walls, multiply layers of smooth muscle, are responsible for the conduits. Next, for my part, I'll be explaining more about the ureter. The ureter, it is interesting to note that pacemaker cell in the proximal renal pelvis cause the peristaltic motion that propel urine along the ureters. As a result, we can distinguish between blood vessel and ureters in vivo because ureters have a whitish, non-pulsatile exterior and peristaltic wave. The ureter's lymphatic drainage resemble the kidneys in many ways. Most of the nodes are named in relation to the aortic segment they pass close to. They discharge to the internal and external ileus node distally. The common ileus and the precavern nodes receive the drainage from the middle segment. They drain proximally to the precavern and the lateral aortic nodes in the lumbar region. The lymphatic fluid then makes its way back to the systemic circulation via the cisternal chylic and the thoracic duct.
Now, move to the next part. So, what is urinary bladder? Urinary bladder is an oval, hollow, muscular organ that is a reservoir for urine before it is excreted from the body. The function of it is become as a temporary storage and emptying the. Now, move to the next. The bladder is located in the anterior portion of the pelvic cavity behind the pubic symphysis. Here are the pictures show the location of the bladder. According to the National Center for Biotechnology Information, NCBI, women can store up to 500 milliliters of urine and men can store up to 700 milliliters of urine. Usually, people will feel the need to urinate or pee when it is between 200 and 300. The bladder is located in the end. This is the structures of urinary bladder. It is same as the stomach. The bladder is lined with rugae, where the folds allow it to expand when it is full and contract when it is empty. So, when you empty your bladder, the muscle in your bladder wall tightens to squeeze the urine out of your bladder, while at the same time, the sphincter muscles at the base of your bladder relax, allowing the urine to flow out through your urethra.
Now, I'm going to talk about the urethra. The urethra is a tube that connects the urinary bladder to urinary meters for the removal of urine from the body of both females and males. There are a few components that we need to know about urethra, which are the urinary sphincters, urethrometers, females and males urethra, and prostate gland. There are two urinary sphincters, one located at either end of the urethra. These muscular rings control the flow of urine from the bladder into the urethra and out of the urethra through the urethrometers. A sphincter is a ring-like muscle that closes a passageway. The urethrometers, also known as the urinary meters, is the external opening of the urethra. The term meters means the external opening of a canal. The female urethra is approximately 1.5 inches long, and the urethrometers is located between the clitoris and the opening of the vagina. In the female, the urethra transports only urine. The male urethra is approximately 8 inches long. and the urethral meatus is located at the tip of the penis. This urethra transports both urine and semen. The prostate gland is a walnut-sized gland located between the bladder and the penis. The prostate is just in front of the rectum. The urethra runs through the center of the prostate from the bladder to the penis, letting urine flow out of the body. The prostate secretes fluid that nourishes and protects sperm.